And just to follow up on that note, is it a common, I don't know, trap? Is it a common mistake for owners that are investigating moving into value-based pricing to be so fixated on the amount? Oh, well, we charge for something like this 500. I'd love to charge 2,000, and by having a value-based conversation, we can get there. Is it too obsessed with price and not taking the time to thoroughly assess the value and the struggles and the pain point? Is that a common trap that goes on during that transition, or is it something else? We'll pass it back to Ron and then put it back to Steve on that.
I think it is a common trap, David. I mean, we're so obsessed with the price, and we've got to start with the value because ultimately value drives price, which means you have to understand the impact you're having on your customer, whether it's their business, their life, whatever it might be. You're trying to figure out that desired outcome. It's not what do you need, tax return audit. It's what are you trying to accomplish, and can we even help you? Because you might not be able to help them. Right? If a millionaire comes to a CPA and says, I want to have zero taxes, you're not going to be able to help them. I mean, that's an unrealistic expectation. So you've got to either lower their expectations or you've got to withdraw. And I just want to say on this question, how do you quote a fixed price on work you've not done before? CPAs and bookkeepers, accountants, we have a professional responsibility to exercise due care. If we haven't seen something before, maybe we should question whether or not we're doing it. We should be doing it, right? Last thing I want to hear from my surgeon being wheeled into the OR is, wow, look at that. I've never seen that before. I mean, I've got the wrong surgeon, right? I'm coming to you because you're an expert. You've been down this road, hopefully hundreds of times. This is, I don't go to a heart surgeon who dabbles in heart surgery, right? I go to a specialist. And so I question the whole black hole mentality that says we've never seen this before. We have to spend more time as a profession diagnosing. We tend to jump right into the work before stepping back and doing a thorough diagnostics. And in medicine, if you prescribe without first a thorough diagnosis, that's called malpractice. And I think it's the same thing for us. If you have to go in and do a the myth is that value pricing doesn't mean you scope. Of course you scope. And the first phase of that scope may be very well a diagnostic. You just go in and get your head around and your hands around what it is that you have to do for the customer. Now you can charge for that. Doctors charge for diagnostic. In fact, in some cases, it's the highest value, right? That is the diagnosis. It's even more valuable than the surgery because knowing what to do is more important than sometimes doing it. We don't spend enough time on that. We tend to dump right into the work, and and I think that's unprofessional. We need to spend more time on diagnostic because, just like the military says, time spent in reconnaissance is never wasted.
I want to dig into the difference, I think, with having the diagnosis. It seems there's a greater emphasis on it, and I want to dig into a bit of what's the difference before and after, because I imagine people are really concerned about, well, hey, Ron, this sounds like a lot of time to put in. I'm not even sure this is a good fit for my firm to go in this direction. I want to dig into that. Before we do, I want to pass it over to Steve real quick and say, are there other or similar mistakes that you see, I mentioned Ron, just so fixated on price and just trying to drive home and back into that versus doing the scope properly? Have you seen other common traps when somebody's going down and investigating value pricing?
Yeah, I agree. It is a very common trap. I think I just want to reiterate as well that a firm must have a true onboarding process. And as Ron's talked about, the diagnosis first aspect and whatever investigation is needed. And okay, sometimes you mightn't be able to charge for that in a particular situations, but most of the time it can be dealt with. But the point is that you must have a crystal clear, exact process of how, from when a prospective client first approaches you through to when you actually have got to the point of starting the work, of exactly what happens, so that you have taken the time to truly understand the outcomes the client wants, to truly understand the issues that might exist within that client's files, within that client's situation, to be able to put together a true price that is based on delivering that the value that they are after. Too often, as a generalization, accountants, we rush to start work. And really what we need to do is actually slow that process down a little and have a clear onboarding process. And people are worried. I think your comment, David, you just said, oh, that sounds, a lot of work to put in up front. But if we start looking at the lifetime value of a client, if we start looking at all those clients that we wish we probably never had taken on in our firm, then having that process up front where we're going through in quite a systematic and process manner of truly understanding what is going on, we're going to eliminate a lot of those red flags. And that's a cost that we don't sometimes truly appreciate, is taking on the wrong clients. So it's going to be able to achieve a better pricing, but it's also going to be able to achieve just a better type of client base.
So I want to dig into the diagnosis a bit. If that's kind of the standard one, which is what I mentioned, somebody says, hey, can you do A, B, and C? And you're like, yeah, I can do it. Here's the price. And they're like, okay, that's close enough to what I want to pay. You're it. That's the standard. How does it now change when you want to move into the land of value pricing? Well, I guess we'll start with Ron and we'll pass it back to Steve there as well.
I would say, like Steve, you have to have a thorough onboarding process. You got to make sure it's the right customer, right? We have a saying that you can't value price the wrong customer, because they're never going to be happy, no matter how technically competent and great your work is. If it's the wrong customer, it's the wrong fit for your firm. And that's not even a pricing issue. That's a positioning and a strategy and a purpose issue. So that's got to be sorted out long before you get to pricing. Is this customer in front of us a good fit? If it's not, don't bother. I mean, you're not going to be able to add value. The other thing is, on the diagnostic, is we need to slow this process down. I mean, like Steve said, the lifetime value of a customer is significant, and this is a significant relationship you're entering into. You wouldn't go out on a first date and ask the girl or guy, so how many kids do you want to have, right? You're going to take time to explore and make sure that this is a good fit. And I want that process to be slowed down. I want you to have multiple value conversations if you have to, because I can't think of a better reason to talk to a customer, either a prospect or a current customer, than to talk about the value that you can add. And the other thing is, I can give you 25 years of pricing wisdom in one sentence. The faster you quote a price, the lower it's going to be. So like your scenario, David, if they call up, I need this, 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 and this, we say, yeah, we do that. Here's the price. They say, okay, close enough. Well, the quicker you quote a price, the lower it's going to be, because you haven't thought enough about value. What about the other services that they may need that might prevent them from having this problem reoccur or something like that? In other words, if we're just out there quoting prices, we're dealing with the symptoms. We're not really dealing with the disease that's causing these problems to recur over and over. And again, that's what it means to be a professional. We have to take responsibility for producing an outcome, getting the customer to the best point we can. And that means we have to do a thorough diagnostic. It's really critical. And I think, quite frankly, I think it's unprofessional if we don't.
Yeah, that's fantastic, and it seems like the line of questions that you can dig into for that diagnosis is critically important. I had one follow-up on that, but before we dig into it, because I know the audience is thinking about this, which is, what if the client pushes for the price? Steve, have you come across, where somebody says, okay, yeah, we love the value price, but we get these calls all the time, and they're like, look, what does it cost to do A, B, and C? I want the price now. I want the price now. The client's pushing for the price. Have you come across firm owners or in your prior firm where somebody's just pushing for price, and in that scenario where you've committed to value pricing, do you cave in and be like, oh yeah, it's $300, or do you realize it's not a good fit? If a firm owner is going through that situation now, or in the near term, because we're getting ready for busy season, what should they do?
So there's a law in VeriSage that actually has Ron's name attached to it, Baker's Law, which is bad clients drive out good clients. And this might be a bad client if they're just absolutely insisting on a price without wishing to have any other conversation. Alternatively, it might be a situation where the client doesn't know what to ask. And it's the easiest question that we will always ask in any situation is, well, what's the price? Because they don't know the correct question that they should be asking, and then the onus is on us as a professional to be able to respond and go, before I can answer that price question, I need to understand a little bit more about your situation and start digging into. But please do remember that there will be those bad clients that are just so price focused. They aren't the ones that we really want to be working with. But it's on us as a professional to stop that, and it can be very simply stopped by, as I said, taking that point that before I can answer that question, I need to understand more. But if the person's not willing for that conversation, then they are just not a good fit. And it is imperative that you make that very early. As Ron said, it's a positioning, it's a purpose issue, that those bad clients are going to just infect all the others. So we need to stop it. But we need to be able to take the conversation over to really what they are really after. I know that you are in the US about to head into that crazy tax season that you have in not too many weeks' time, and there's a lot of focus around that. But there's so many other things that I think the one little mistake that too many firms focus on is that they're just selling a particular service, be it tax preparation or payroll or whatever it might be. But really we need to just take that step back and try to understand where that person is going, where that business is going, and have that more wider lens view of how you can assist, rather than just we've got these couple of service offerings and we can sell that to you.